Good afternoon, students. I hope you can listen me. I'm showing few histology slides to you for your practice. I'm showing in the recording as I don't want to misuse your time. Just to see, this is the systemic histology. It is starting from the cardiovascular system. First, just in cardiovascular system, one thing I would like to tell that what the things are here, heart and the blood vessel. Common structure of the blood vessel is what? Tunica intima. Just follow my pointer. This is the tunica intima. So simple squamous epithelium, lining epithelium is there. Its name is the endothelium. Then tunica media contain the smooth muscle and elastic fiber. In elastic artery, elastic fiber is more. And this is the tunica adventitia. So if you are getting the blood vessel, the commonly this is the identification is the blood vessel, and it's the histological structure or identification point is it has 3 layers. This is the one line. Second point is the inner layer is the tunica intima lined by the simple squamous epithelium, endothelium. Second point is the tunica media composed of the smooth muscle and elastic fiber, and the tunica adventitia, it is the connective tissue layer, contain the blood vessels and nerve. So this is the common histological structure. Just keep remember, if it is elastic artery, so elastic fiber is more. If it is muscular artery, so the muscle cell are more in the tunica media. So very simply keep remember, identification is for you 1 point and the 3 layers. Inside to outside, just need to mention the layers and need to mention 1 line for each. This is the identification points. You might get like this. Now, I'm not telling regarding the blood vessels anymore. Sharply, I'm going to the capillary. Capillary has the little change. Only the simple squamous epithelium, endothelium, and basement membrane. When there is no fenestration on the cell membrane and on the basement membrane, it called the continuous capillary. When there is the gaps or pores on the cell membrane and the basement membrane, so it called the fenestrated capillary. It might be with diaphragm, might be without diaphragm. With diaphragm in the intestine, without diaphragm in the renal glomerulus. And this one is the sinusoidal capillary. Here the cell has the perforation on the cell membrane and the basement membrane is not continuous. That means discontinuous. This discontinuous capillary is called the sinusoid or sinusoidal capillary. It is located in the liver. You know it. So this regarding the capillary. Now in the cardiovascular system, heart is there. So heart's histology structure inside to outside, endocardium, then myocardium, then epicardium. Endocardium is the simple squamous epithelium, myocardium is the cardiac muscle, and the epicardium is the connective tissue layer over the cardiac muscle outside. Now this is the cardiac muscle. How to recognize? It is the branching cell are there. Cells are the striated, cross striation is there. Cell has the single nucleus. Cell has branching. Cell has intercalated disc. So these 4 are the property of the cardiac muscle. Now I am moving to the lymphatic vascular system. This is the thymus, that means lymphatic organ. So this thymus, when you are seeing, you see here, thymus is a gland, so it has outer capsule. This is the outer capsule inside the parenchyma. Capsule sends septum inside and divide into different lobes. One lobe is contained outside cortex, inside medulla. So this thymic cortex is contained the immature T lymphocyte, and thymic medulla is contained the matured T lymphocyte. And this the aged thymus, after puberty, it having inside one nodule-like structure. Its name is the Hassel's corpuscle. So these are the structure of the thymus. If you are getting, so histological structure is what? This is the histological section of a thymus. So how you can recognize it? At least 2 identification feature. It has the outer cortex and inside the medulla. In the center of the lobe is the medulla. Cortex contain the immature T lymphocyte, medulla contain mature T lymphocyte, and Hassel's corpuscle present here. So these are the identification features of the thymus. Now, these one, the lymph node. Lymph node, it also has the outer capsule. This is the tonsil, palatine tonsil. This is the outer capsule is there. Outer capsule you are seeing. Then inside you are seeing the many lymphatic nodules. So, and it has the crypts. These one in the important feature of the tonsil. So identification is what? This is the tonsil, and the identification points, crypts are present, lymphatic nodules are present, and this is the stratified non-keratinized stratified lining epithelium is present. Why? Because it is inside the oral cavity. So this is the tonsil. Now see, this is the lymph node. Lymph node has the outer capsule, then subcapsular sinus. One space is there, subcapsular sinus, because from the lymph node, afferent vessel come. It bring the lymph from the tissues, and this lymph goes to the subcapsular sinus. Then inside we are getting here cortex, and this one is the medulla of the lymph node. Cortex has the lymphatic nodule, and the medulla has medullary sinus, and here is the efferent lymphatic vessels. So what the identification? This is the lymph node, histological structure of lymph node. But the identifying points, outer capsule is present, then subcapsular sinus is present, then cortex contain lymphatic nodules, medulla contain medullary sinus, and efferent lymphatic vessels present. So these 5 points, what I said, these 5 points are the identification features of the lymph node. Now you see the enlarged picture of the lymph node. This is the cortex one. This is the lymphatic nodule. This is the capsule, after that subcapsular sinus, and this is the lymphatic nodule you are seeing. The one is the primary nodule, one is a secondary nodule. This germinal center, it is there. So this is the secondary nodule active form. So just keep remember, you have to just identify the histology structure and the 5 points what I said, the identification picture need to keep remember. Now I am moving to the spleen. So the spleen, also the lymphatic tissue, secondary lymphatic organ. It has the outer capsule and inside the parenchyma. Outer capsule, from there the septum extend inside the parenchyma and divide into the parenchyma into the compartments, and these parenchyma contain white pulp and the red pulp. So these are the white pulp, all are the white pulp, and the in between the white pulp, the area called the red pulp. White pulp contain what? White pulp contain the central arteriole that placed in the eccentric position, and the lymphatic nodule around it. It contain the B lymphocyte, and this is the central arteriole what you are seeing here. It is not arteriole, and on around the central arteriole here is the periarterial lymphatic sheath. This periarterial lymphatic sheath contain the T lymphocyte, and in these the red pulp contain the blood cells and the splenic sinusoid. So these splenic sinusoid you are seeing, these all are the splenic sinuses, venous sinuses are there, and the blood cells are there. So histological structure of spleen, if you are getting like this tissue, so your identification will be what? Outer capsule, inside parenchyma. Parenchyma has the red pulp and the white pulp. White pulp characterized by the central arteriole and the lymphatic nodule. Around the central arteriole, periarteriolar lymphatic sheath, it contains the T lymphocyte, and the lymphatic nodule contain the B lymphocyte. And in the red pulp contain the blood cells. That blood cells form a cord, is called the splenic cord, and the sinusoid, splenic sinusoid. Just keep remembering